what is the liver? The liver is the largest organ in your body, second to the skin. The skin is actually the largest organ. It's located in the upper right corner of your abdomen, and it does about 500 jobs for your body, and we'll discuss those shortly. It is the only organ in the body that can regenerate itself. So why is the liver important? The liver is your body's filter. It removes toxins. Everything we eat and drink, to include food, drugs, herbal supplements, medications, is filtered through the liver. This means the liver helps break down toxins to remove them from the body. The liver also helps with digestion. It breaks down fats and cholesterol. It makes a substance called bile, which helps the small bowel digest fats and cholesterol so your body can use them. It also breaks down carbohydrates and proteins so we can use those nutrients to help rebuild the body, rebuild muscles, and also provide energy. So this presentation is discussing primary liver cancer. This is a cancer that begins in the liver. This is different from cancer that goes from other organs and spreads to the liver. So hepatocellular cancer is the most common type. More than 80% of primary liver cancer is hepatocellular carcinoma. The other types, you can have bile duct cancer or intrahepatic cholangiocarcinoma. This is not very common. This is seen in maybe 10 to 20% of liver cancers. Then there are two other very rare types, angiosarcoma and hemangiosarcoma. Those are very rare, and those are usually linked to chemical exposure.
Primary liver cancer is a cancer that begins in the liver. That's important to recognize, because sometimes I'll ask people about different cancers they have, or if their family had cancers, and they'll tell me that the person had liver cancer when it probably was unlikely that they had primary liver cancer, and they may have had metastatic disease to the liver. So often cancers from other places can go to the liver, but that is different than what we're talking about today, which is primary liver cancer, meaning that the liver cancer started in the liver itself. Okay. And so the most common primary liver cancer is hepatocellular carcinoma, or HCC, as we mentioned, and that makes up more than 80% of primary liver cancers. Well, how common is liver cancer? So unfortunately, liver cancer is on the rise in the United States. And that's unusual because most cancers actually are on the decline. Like, we're getting better at diagnosing, we're getting better at screening. So therefore, we're seeing less of them. Overall, we're getting also better at some of the risk factors associated with other cancers. Whereas liver cancer, it's been the opposite, that's been on the rise. There's actually up to a 34% increase in people with liver cancer from 2000 to 2019. And it's estimated that around 41,000 Americans will get liver cancer diagnosis in a year, or in this year alone, and 30,000 are estimated to die from liver cancer. I mean, that's really staggering. And I just want to point out what's really staggering and concerning is that if 41,000 get the cancer, then 30,000 die from the cancer. You can see that the outcomes with liver cancer are not good. So it's not a cancer that you want to get, because when you get it, we don't always do the best job at getting it treated and cured. And it's a cancer where a lot of people do end up dying from their cancer. So if we can try to prevent the development of liver cancer, that's by far what we want to try to do.